Hello guys, welcome back to my channel Medicogyaan, the final stop of all your medical queries. I hope everyone is good and taking care of themselves. Please subscribe my channel if not done already and press the bell icon button to receive the further notification. So friends, today the topic of discussion of this class is hypokalemia. In this video, we shall be studying about the physiology of the potassium ion, the definition of hypokalemia, the causes of hypokalemia, the signs and symptoms and the treatment part of it. So let's go and study about the physiology of the potassium ion. Potassium, as you all know, is a major intracellular cation. So if this is a cell, then the 98% of the potassium is present inside the cell, while the 2% of the potassium is present outside the cell. The total body potassium in human is 50 milliequivalents per kg. So if this is a guy having a weight of around 70 kg, then the total body potassium will be 70 into 50, which is equal to 3500 milliequivalents. And the normal body potassium value is 3.5 to 5.5 milliequivalents per liter. So this is about the physiology of the potassium ion. So after studying the physiology of the potassium ion, let's study about what is hypokalemia. Hypokalemia is something in which the body potassium level is less than 3.5 milliequivalents per liter. So now study about the causes of hypokalemia. Hypokalemia means less of potassium. So the mnemonic is less K. L stands for the Lasix or diuretic. Giving large amount of Lasix or diuretic to the patient can cause flushing of the potassium into the urine, which will cause hypokalemia. E stands for the enteric loss, as in cases of diarrhea and various fistulas in the body. Friends, as you all know, the GI tract is a good source of potassium. So in cases of enteric losses, the potassium will be lost in the feces, so there will be hypokalemia. S stands for the steroid, as in the cases of Cushing syndrome, exogenous steroid, and primary hyperaldosteronism, which is also known as CON syndrome. In all these cases, there will be increase in the blood sugar level, because of which the body will try to increase the insulin, and this insulin will cause shifting of the potassium into the cell, so there will be hypokalemia. Now comes the S, which stands for the shift, as in cases of alkalosis, treatment of DKA and periodic paralysis. In cases of alkalosis, there is increase in the body pH, which means the hydrogen ion is less. So hydrogen potassium pump will be activated, which will exchange the hydrogen for the potassium. So there will be decrease in the potassium here. And in treatment of DKA, there is usage of insulin, which also decreases potassium. And in all kidney disease such as renal tubular acidosis and Liddle syndrome. So all these are the causes of hypokalemia, which will cause decrease in the potassium less than 3.5 milliequivalents per liter. Now comes the sign and the symptoms of hypokalemia, which can easily be memorized by 6 L, where the first L stands for the lethargy. As you all know, potassium is very important for the resting membrane potential. In hypokalemia, the RMP is disturbed, because of which the muscle contraction is not proper and the patient will be lethargic, and there will be low or shallow respiration, because the skeletal muscle, smooth muscle contraction will not be there, hence the respiratory efforts will not be there. There will also be limping of the muscle because of the decrease in the potassium ion. So the person will not be able to walk properly. There will be lethal cardiac disturbances because of hypokalemia. As the potassium ion decreases, the cardiac contractility decreases, and hence cardiac monitoring is very important in cases of hypokalemia. There will be leg cramps. So leg cramp is also a very common feature of hypokalemia, and also there will be lots of urine passage, also known as polyuria, because the patient might be having treatment of diuretic laxative, which will cause flushing of the potassium into the urine, so there will be polyuria. Now what are the ECG changes in cases of hypokalemia? As we all know, because of the decrease in the potassium, the cardiac contractility is affected, and because of which there are certain ECG changes. The first and the foremost will be the T wave will be shallow, after which there will be prominence of the U wave, and there will be prolongation of the PR interval and ST depression. So these are the ECG changes which are particularly seen in patients with hypokalemia. So cardiac monitoring is very So now comes the treatment part of it. How will you treat the patient after having diagnosed with hypokalemia? The first and foremost is we have to stop the ongoing potassium losses. As a patient might be under the treatment of diuretic, laxative, which will cause flushing of the potassium into the urine and stool, so we have to stop those. As already discussed, you know that the GI tract is a very good source of potassium, so you have to treat the diarrhea and vomiting because it will cause loss of potassium. Your doctor will also recommend you to have H2 blocker such as ranitidine to decrease the nasogastric suction losses, which will eventually decrease the potassium ion. After stopping the ongoing potassium losses, we have to replace the potassium which has been lost already. If the total body reserve of the potassium decreases by 200 to 400 milliequivalents, then the serum potassium will decrease by 1 milligrams per deciliter. It can be replaced by either by oral therapy or by a parenteral therapy. Oral potassium therapy is normally well tolerated and your doctor can prescribe you syrup pot chlor. If this is not good enough, your doctor can also give you parenteral IV preparation, which can be given in the form of IV therapy with a dose of up to 10 milligrams per hour can be given. But sometimes this is not good enough and the potassium preparation has to be given by the larger route, that is by central line, where the dosage can be given up to the dose of 40 milliequivalents per hour. This route is preferred when there is a moderate to severe hypokalemia. So thank you guys for watching this short video on hypokalemia. I hope everyone understood this lecture well. Please subscribe my channel if not done already and press the bell icon button to receive the further notification. Also, please stay tuned for my upcoming videos on www.medicogyan.co.in.